Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it's time to return a lot to the word. The topic of today is dengue fever. It is also called dengue and dengue hemorrhagic fever. It is a mosquito-borne arbovirus disease found in the tropical and subtropical regions in urban and peri-urban areas. DHF, dengue hemorrhagic fever, is a lethal complication recognized in 1950s, leading cause of the childhood mortality. Four closely related viruses which cause dengue are den 1, den 2, den 3 and den 4. Last two, den 3 and den 4 are dangerous. They cause hemorrhagic dengue and the fatality is because of these. Traditional dengue fever is not serious and curable in 7 days like other viral diseases. So these are the four variants of dengue viruses, that is then V1, then V2, then V3 and then V4. So these are four variants of the dengue fever. Now the introduction of the disease, this disease is called break-bone fever, causes severe joint and muscle pain that feels like bones are breaking and the patient says that he has got very severe body ache. It is RNA viruses of the family Flaviviridae. Four serotypes, as I have already told you, 1, 2, 3 and 4 are responsible for causing disease. A person can be infected as many as 4 times, once with each serotype, but recovery from the infection by one serotype infection provides lifelong immunity against that serotype only, like serotype 1, but still a person can be infected by serotype 2, 3 and 4. Sequential infection increases risk of the more serious disease resulting in the DHF, but the first time infection is not a very serious, it's a mild viral problem. So that is the patient usually present with very severe headache, prolonged fever and the skin rash, which are just giving you the clue that the patient may be having the dengue fever. Now the history of the dengue is the first reported epidemic is 1779 to 1780 in Asia, Africa and North America. These viruses and their mosquito vector have had a worldwide distribution, considered a benign non-fatal disease of the visitor to the tropic and subtropic region. Epidemics caused by the multiple serotypes, hyperendemicity, are more frequent. In 1997, dengue has global distribution comparable to that of the malarial disease. The case fatality rate of the DHF is about 5%, mostly in the children and in the young adults. So history, if you go back to know from where it has come, the Aedes mosquito, as one can see here, that has infected the primates, the monkeys, and from the monkeys, this mosquito infect the other monkeys. So the disease is spread between the monkeys via this Aedes mosquito. But just by chance, when the human being came into contact with Aedes mosquito, the mosquito has injected the virus into the human being, and from this human being who is a carrier of this virus, the mosquito has just bitten this man and has bitten this man, again a human, and spreaded the virus from this mosquito to this human, and now it has become carrier, and from here the mosquito bite can spread to the other human. So this is how the mosquito, Aedes mosquito, from the monkeys and the primates have transferred the infection to the human being by accidental biting to the human being. Now, reason for the global emergence of the dengue or dengue hemorrhagic fever is there are three most important factors. Number one is not effective mosquito control in most dengue endemic countries. Number two, the major demographic changes, that is uncontrolled urbanization and population growth and substandard housing and inadequate water supply, sewer and waste management, and all increases the Aedes aegypti mosquito population densities and transmission of the Aedes aegypti borne diseases to the human being. Number three is the increased travel by the airplane provides transporting the dengue virus from the tropic, subtropic region to the climate region and other countries where it have never been seen. So that is the Aedes mosquito. Two of its variants are responsible for spreading this disease. One is mostly Aedes aegypti and the other is Aedes albopictus. Now the prevalence in the world, the global prevalence has grown. Disease is endemic in 100 countries. Before 1970, only 9 countries had experienced dengue hemorrhagic fever epidemics. Now some 2,500 million people, 2/5 of the world population, are at the risk of dengue. It is said that one should work so hard that one day your signature will be called an autograph, and you will just put your signature and people will just preserve this as an autograph. Now the mosquito which are mostly culprit and notorious for spreading this disease are Aedes aegypti, and here one can see the shape of the Aedes aegypti. Their tail is downward, they have got some spots, and from this shape one can recognize that it is Aedes aegypti, and it is different from the mosquito which spreads the malaria anopheles. And here one can just keeping in mind the shape of this and the color of this mosquito, one can come to know that one have been infected or one have seen these mosquito in your near vicinity. Now, these are the viruses which these mosquito spread from one infected person to the another non-infected person. So, like other viruses, the dengue virus have got viral genome which is in the center, then nucleocapsid which just covers like a cap, then E and M proteins which are important protein for the multiplication of the viruses, and the viral envelope that is just like a capsule of the bacteria. Here again one can see the viral genome, the nucleocapsid, E and M protein, viral density. And here that is very important, NS1 protein, which is the base of detection of this disease earlier in the serological test. So that is the dengue virus, and these are the mosquito responsible for the spread. And here the virus contain NS1, which is a landmark to just have the diagnosis of dengue virus. Now the transmission of the disease. Humans are the main host, other are the monkeys, as I have shown you in my previous slide. Transmission is from person to person by the bites of the infective female Aedes mosquito. Why the female Aedes mosquito bites? Because it have to produce the eggs and need the good nutrition. for the propagation of their generation. So these female do suck the blood of the human as the part of the feed to the eggs production. Mosquitoes get virus while feeding on the blood of an already infected person. Infected female mosquito also transmit virus to its next generation by trans-ovarian transmission, that is, via its eggs. The virus circulates in the blood of the infected human for 2 to 7 days. That is the time when the fever remains in the person who has been infected by these mosquito. Dengue is not contagious from person to person. And here one can see the person who is already infected and this has been bitten by this mosquito. Now this mosquito is infected mosquito, Aedes aegypti, and when it bites to the other healthy person, it transmits the virus which this mosquito have got from this person and transmit to this person. And the incubation period when the symptom appear in this healthy man, these are 3 to 14 days. Similarly here one can see the infected person with the red spots is being bitten by this mosquito, and this mosquito takes a virus from the blood of this person and then it infect and inject the virus after biting this healthy man and inject the virus to the blood of this healthy man. Now this healthy man become again the infected and the mosquito just take the blood from this man to infect the another healthy man. So Aedes mosquito, Aedes aegypti and Aedes albopictus now acquire virus if feed on infected individual, as I have already shown in the slide. Mosquito cannot transmit dengue virus among themselves. They are immune to these viruses. They first bite a person who is already infected with dengue virus. The infected mosquito will then carry dengue virus and pass it on to a healthy person when it bites or her, as one can see this slide again to be clear how this disease is transmitted. Now, the virus has been transmitted and the pathogenesis. What happens when the virus get entry into the human body? Incubation time ranges from 3 to 10 days. As virus disease is self-limiting, it's 5 to 7 days to recover. It is said that if you treat the patient, it will take 7 days, and if you will not treat the patient, it will take 1 week. And after 1 week, it is a self-limiting disease and the patient become okay most of the time. As this virus makes hole in the blood vessel, so smallest particle of the blood platelets leak out from these holes, which these viruses make in the blood vessels of the host, and followed by the water, so the dehydration, water also comes out from these holes. At day 1, platelets, for example, are 170, and at day 2, it will be 150 leaking from those holes made in the blood vessel. So the platelet will come out and there will be the decrease in the platelet. And at the day 3, platelet will be 100, and at day 4, the platelet will be 75, and at day 5, the platelet will come down to 50, which makes the patient very alarming, and the patient thinks that it is very dangerous to have that much number of platelet, but it is not very serious. At day 6, platelets start increasing by auto recovery system, and the people use at this time, when it have gone to 50, the different treatment, thinking this has increased their platelet, which is totally wrong. It is basically the auto recovery system of the body which have made risen the platelet from the 50 to the 170. Again, here one can see that mosquito is infecting and injecting the virus, and the cells of the skin, which are the macrophages of the skin, dermal macrophages of the skin, and these Langhans cells these are just going to take up the virus, and the virus that start replicating inside. Here one can see the dengue virus is just getting enter into this macrophage, and it is multiplying inside the macrophage. And ultimately, if you look at this diagram, when the skin Langerhans dendritic cells are infected by the virus, as the virus goes inside that, and these dermal dendritic cells are being infected, and the dermal macrophages and the infected, these all macrophages, these are going to migrate into the regional lymph nodes, the draining lymph nodes, and the rest of the process occurs here as the macrophages release the certain mediators which are responsible for producing the symptom. Now, you just consider this pan with small holes, and this is just like a blood vessel. If there are small holes in this blood vessel, the platelet will come out from this pan, and the rest of the cells, as one can see, the RBCs and the WBCs and the larger size cells of the blood will remain inside. But as with the passage of time, the holes will widen, will become more larger as it is in this pan, and one can see the larger holes in the blood vessel. So it will allow first the platelet, then it will allow the RBCs and the WBCs and the other contents of the blood cellular element to come out from this, and then the plasma, and ultimately this is going to cause the appearance of the dangerous bruises and ecchymosis. Here one can see the platelet at day 1 are 170, day 2 are 150, day 3 are 100, day 4 are 75, and ultimately fall at day 5 to 50. But at day 6, it starts recovering, auto recovery system, and it is going to become 170 and more with the passage of time, that is day 6 and 7. Now, myths of the dengue, certain people recommend the fruits, the leaves, the extract of kiwi, the spine, pomegranate, vitamin C, and different Indian gooseberries, and this is very famous, being used by the people, and it is said to be that it is going to increase the platelet of the person, but all these are the very wrong. Similarly, the different fruits, as one can see, foods, these are also said to be and considered to be raising the platelet of the person. Now, the pathogenesis continued. When infected mosquito bites a human, put the dengue virus in the bloodstream, I have already told you, it binds to the platelets and replication of the infection virus destroying the normal platelets. The patient developed thrombocytopenia and hemoconcentration. As I have already told you, from these holes, some of the platelets leak out and some are being infected and being destroyed by the virus itself, causing the thrombocytopenia, and there is the leakage of the fluid from the blood vessel causing the hemoconcentration. There is a leakage of the platelet and the plasma from the vascular compartment also. This is dengue hemorrhagic fever, which is dangerous, DHF, and it can lead to the dengue shock syndrome, which is much more dangerous and responsible for causing the death. If not corrected right in time, that cause profound shock and ultimately the death. Signs of this dengue hemorrhagic fever are restlessness, cold skin, rapid weak pulse, decreased pulse pressure, hypotension. Warning signs are severe abdominal pain, protracted vomiting, marked change in the temperature from fever to the hypothermia, high temperature or low temperature, change in the mental status of the patient, irritability, skin hemorrhages like TKI, purpura, ecchymosis, and epistaxis, bleeding, gums, hematemesis, and melena has been seen, and fatality rates among DSS, dengue shock syndrome, is 44%, which is the dengue hemorrhagic fever leads to the dengue shock syndrome, which is very fatal and causing 44% fatality. If treated on time, mortality rate is less than 15%, but with the proper treatment. Here one can see the site of the bleeding and the frequency. TKI alone are responsible for 85%, melena 6.1%, ecchymosis 2.5%, epistaxis nasal bleeding 2.5%, hematemesis vomiting with blood 1.3%, gum bleed 1.3%, and menorrhagia is also 1.3%. And to sum up the pathogenesis, the dengue infection causes infection to the monocyte and Langerhans cells, and that is going to release vasoactive mediators, and these mediators are responsible for causing the increased vascular permeability, causing the hole in the blood vessel, and this ultimately lead to the end, that is the plasma leakage and hemoconcentration.